Well, it's hard to believe, but some students will head back to class next week. Yes, next week. So now is the time to get your ducks in a row before the first day arrives. We're not just talking about new notebooks, pencils, backpacks, but updating medical records and getting back into that healthy routine.
School nurses are among the unsung heroes of every school. Trained to handle everything from minor bumps to medical emergencies, making sure all the vaccines are up to date. But there are some things that parents can do to help make their job much easier. And Lynn Wyrick is a Community Health Network school nurse at Amy Beverland Elementary, joining us to talk more about school nurses and what they wish that parents knew. There's a long list, so we're going to start, just talking about some of them. And I wanted to start with the vaccine part because I had just said it, and because my daughter, who is she's in college, but had to get a vaccine, and that can be one of the top things that kids don't want to do, and parents sometimes are not up to date, and they have to be before school starts.
Right, you're exactly right. And perfect timing to do it is in the summer. It's time for all the good rest and fun times and all that, but it's also a great time to do some homework. Vaccines being one thing that you can do. It's a great time to look at your children's vaccinations, make sure they get into their provider, go to a vaccine clinic, get that done before school starts conveniently without the pressure of the school year starting.
And just to follow up on that, because a lot of times you can't be in school
some districts, it's district dependent, but getting it done before the pressure of, appointments are gone and school starts, just do it in the summer. It's really the time to do it, prime time to do it.
And definitely mentioning the checklist, but there are also some students that may have chronic conditions. Want to make sure you have things filled out and the appropriate protocol if they get sick.
Yes. So students that have chronic health conditions, and by that I mean students with things like asthma, seizures, life-threatening food allergies requiring like an EpiPen, diabetes, summer is the great time to work with your provider to get those plans in place. There's actually a written action plan that is then shared with the school, and we can take the best care of the student. It's best for safety and for communication with your children's teachers and team.
Yeah, is there one thing that comes up with that emergency plan that seems to be the one thing that's left out more than anything, or that you have to deal with?
Probably exercise-induced asthma, making sure that's attended to, because especially in the elementary schools, we have PE, we have recess, they do special physical activities that, if you have asthma, that can come into play.
Okay.
So those asthma plans are very important for us to have, as well as the inhaler.
Okay.
That kind of leads me into the second thing to do with chronic health. If your child needs medications that are prescriptions, get them filled in the summer and be up to date and have them ready to go for the first day of school.
I do notice that when the school year starts, you see the long line outside the pharmacies of vehicles that are parked picking up prescriptions. Let's talk about coming off that summer season and getting adjusted to the new schedule back again. I mean, for some kids, it's hard to wake up for that bus.
Yes, sleep is paramount. If you don't have a well-rested brain, the children aren't ready to learn. Their brain is tired and exhausted. They can't retain. So getting your child, the closer you get back onto a good sleep wake and good sleep, is very important for learning.
Yeah.
So get those screens put away in the evenings so that they can wind down, get back in the schedule, and wake up ready to go.
Our sleep expert comes in all the time and talks about that. They're like, at least an hour and a half before bed, if you want to actually be able to get to sleep and not have all of those racing thoughts in your mind, that's how you do that. But it's all, and now the schools have more plans too, and not letting the phones into school. So maybe that will help you as well.
It
Maybe.
should. Well, we have things in place about that too. But I know everyone talks about screen time, but it's a real thing.
It is a real thing.
And you're not going to take them away from the kids, but before bed, so that they can wind down and can relax their brain to fall asleep.
Well, the parents have to follow the rules too, because if their kids are seeing them on the phone and not talking with them, they're going to be like, okay, I should just have my phone on.
I'm guilty.
And I don't even have any kids. But let's talk about, as we do get into that routine, though, it is important to have that checklist.
It is.
Telephone numbers up to date, things like that.
Emergency contacts, phone numbers, your emails, all those communication up to date. It's also important to make sure if your child does wear glasses that they have a current prescription and the glasses aren't broken, they're working order.
Get an extra pair.
Get an extra pair if they do sports and all that.
I think it's hard too. One of the things before COVID, I think it was a lot more common, but sick kids would go to school. Nowadays, it's like, okay, what is considered sick? What is that temperature? If you have it over a certain number, do not send your kids to school.
Well, the big thing about that is obviously, just saying it out loud, if your child is sick, please don't send them to school for the child's sake, for the school's sake, the staff's sake, all that. Yes, that's absolutely true. But you do have to look at your own district because there are different policies and
Okay.
things in place. And it might be, you also have children that are in preschools and there are different rules for
Okay.
that. So you do have to really, I can't speak broadly actually, because it's,
Very
I'm
specific.
from Lawrence Township,
Yeah.
which I love Lawrence, but you have to follow the school district's policy. So know that. It's usually
Okay.
like a very short parent-specific one-pager, like these are the things, da, da, da.
Okay.
But you can use your school nurse to help work through those too. If you have questions, if you're not understanding, if you want clarification or to know specifics, call your school nurse. We're glad
This
to
is,
help.
and this is an important one here because sometimes the nurses don't know all of these kids. Parents should check with their school nurses about their own child's
About their
mental health.
own, yes, mental health for sure. School nurses, we follow HIPAA. We're a safe, secure, confidential, private place. If you have other obstacles for learning in school that are medical or social in nature, emotional in nature, if your child struggles with, say, anxiety, stress, if there's been a loss or grief in the family, if there are other social stressors like food insecurity, lack of medical care, talk to your school nurse. We can get you to the right people and we will help.
Well, you're fantastic. I want you to be my nurse, and my kids are back in
back to
school,
school.
right? Come
Go back to
on,
school.
right? That's awesome.
Well,
Good to have you.
I do love school
Yeah,
nursing.
you can
so-
tell.
All right.
All right.
Lynn
Great.
Wyrick, thank you so much for being here.
Very
You can
good.
come back anytime when
Okay.
school starts.
Right? You're awesome. Hey, still ahead on this midday. Age is but a number, but that. Oh, you know what? We're doing weather first.
Yeah, Amber, you got a
I'm
little.
excited to read
Amber,
what's in
you
the
got
teleprompter,
you got a
Amber.
little one starting school.
Yeah, so he will be starting first grade this year. All great tips and advice. I learned a lot from that segment. Thank you so much for coming in.